The physical arrangement is different, and that is to try to really focus. I have a discussion, notation. If there are people from the VA here, you're welcome to join us at the table. I don't know if we made that clear. We want to have a conversation between our committee members, VA staff, and outside experts, and have a discussion as opposed to a normal hearing where it's more of a, I don't know, almost a confrontational kind of thing. We want to have a discussion. And this is the first of several of these roundtables, the first of also a couple on PTSD, also on traumatic brain injury. Next week we'll be doing one on the claims process of the VA. And I appreciate all of those who have accepted our invitation to be here. We all know that I think that PTSD, post-traumatic stress disorder, by the way, one of the charges I'm going to give to our experts is to give me a different name. For example, stress injury, or to get it out of the sense that this is a disorder, and therefore a stigma attached, therefore hard to admit, therefore maybe difficult to talk about. In my view, if you don't have some of the reactions that we call label under this category, you're not. And I'd be worried more about the people who didn't have stress from the experiences that they had. But I think we all know that in general, mental health in this nation is not given sufficient due and sufficient study, sufficient importance. There's a tendency to not talk about it, to put it under the rug, and I think that goes double or triple for the military. It's very difficult for those in a military system to admit a mental health issue. There's fear that promotions will be slowed up or not given. There's a denial that someone so well trained and so trained to be an expert in combat would have any problems with mental illness. So we have to, I think, make sure as a society we bring it out, and that's one of the reasons for this attempt to do this. We have obviously specific issues with regard to the PTSD in the current war and in previous wars. Without sufficient understanding and treatment, rehab, we fall, I think, into the mistake that we made after Vietnam. We did not give sufficient due to the mental illnesses from those veterans. And I don't think it's a stretch of the imagination to say that as a result, half of the homeless on the street tonight are Vietnam vets, almost 200,000. And that comes from our lack of dealing with issues of our returning service people. We did not give them the treatment, the help that they needed. And I think it's a moral blot on our record to have that situation existing. And this committee has not given up, by the way, on dealing with those issues. We have the same phenomena of our returning Iraqi and Afghanistan veterans. Virtually, I would say virtually everybody has some degree of the stress that comes from combat and in battle. The figures I see are 30%, 40%, 50%, but they're very high. And that means tens of thousands, if not hundreds of thousands of people who will have this, and we have to deal with it. So we want to deal with issues surrounding the diagnosis of PTSD, the treatment, the rehabilitation. Are we doing that right as far as your understanding in the military and the veterans community? What do we need to make sure that the screening is done properly and comprehensively enough and mandatorily enough, in my opinion? What about eligibility for treatment? I am told that if you have both PTSD and substance abuse, you may not be admitted into the treatment program, and yet those two diagnoses are pretty much connected in so many of the cases. So we're not even caring for such a great percent of the of our returning soldiers. How about the access to treatment, just in terms of when they can get treatment from the VA centers? People working, people are going to school. How about evening and weekend hours for this? Staggered staff. Do we have sufficient resources in place? I'm convinced we do not. We have heard, whether it's horror stories or anecdotal information or reports about veterans waiting weeks, if not months, for treatment, insufficient staff, overworked staff, inability to meet the tremendous burden on the system. The last figures I saw was of the first 700,000 veterans from the current war, almost 200,000 had submitted claims in the VA. That means tremendous physical and mental illnesses. What about our outreach? Clearly, this nation does not understand PTSD, but think of the support a returning soldier has if everybody at least understood what they went through, whether they're in a classroom, at a church, at their place of work, in their neighborhood. People can then reach out and help. What about the children? There must be 1 million children of those who are deployed now, were deployed, will be deployed. I've trying to get a video made for children about what PTSD is. So if they observe the symptoms in mom or dad, they can have an effect on that immediately. Of course, the whole nation has to understand what this is all about. What about getting new people, new treatment, getting more staff in, the recruitment of all, whether it's psychiatrists, but also social workers and others who are needed to be for a holistic treatment of PTSD. Are we even doing the exam? A lot of them are outsourced. Are we getting the proper diagnosis? And is the recovery model appropriate for what we need in terms of long-term adjustment? These are some of the issues that I hope we'll talk